Hi, this is a discussion in the overturning of Roe versus Wade, a political and ethical conflict in emergency care. My name is Sarah Putzer. I'm a registered nurse with a specialty in emergency care, currently pursuing my master's of nursing with family nurse practitioner emphasis from Auburn University. Today's discussion is for other nurse practitioner students and how their care may be affected for patients experiencing medical emergencies. Let's take a quick look at the turn of events over the last 6 months. In June of 2022, the Supreme Court overturned the Roe versus Wade, revoking the nationwide legal right to abortion. The Dobbs ruling in June now allows abortion laws to be determined at the state level, which has created a ripple effect across the healthcare continuum. The Supreme Court's overruling has changed the landscape of women's healthcare as we know it for the last 50 years. As an advanced practitioner, the overturning poses two big issues: access to emergency care and maternal mortality. The overturning of Roe versus Wade creates concern about whether women experiencing pregnancy complications will have access to emergency care without delay or consequence. In addition, the overruling creates concern for increased maternal mortality based on some states' restrictive abortion laws. As advanced practice nurses, especially nurse practitioners, it's essential to understand state laws while advocating for our patients' reproductive health care needs. So one issue we have is maternal mortality. So let's take a look at historically what this means. Maternal mortality is thought to be directly correlated to unsafe or illegal abortions and accounted for close to 20% of pregnancy-related deaths pre-Roe. Maternal mortality sharply declined following the passing of Roe versus Wade as women gained access to safe health care and pursued reproductive health without fear of legal ramifications. With the overturning of Roe versus Wade, maternal mortality rates are expected to increase in states with restricted or banned abortion access. Some states banned abortion immediately following the overturning, while others waited 30 days, and some have left laws in place to protect abortion. So let's take a look at emergency care access. A medical emergency is defined as an illness, injury, symptom, or serious condition that a reasonable person would seek care immediately to avoid severe harm. Pregnancy conditions requiring emergency medical intervention include incomplete miscarriage, ectopic pregnancy, premature rupture of membranes, and mental health stabilization. Restrictive abortion laws create political and ethical conflict for healthcare providers on how to abide by the laws that do not allow abortions but uphold the moral obligation to provide care while protecting the rights and safety of women. In emergencies, advanced practice nurses may be forced to seek legal approval and guidance before providing necessary life-saving interventions, ultimately putting the patient's life at risk. So let's take a look at how federal and state laws conflict, posing political and ethical conflict. EMTALA is the Emergency Medical Treatment and Labor Act, passed by Congress in 1986, requiring all hospitals with emergency departments to provide access to care, including stabilizing treatment. Following the overturning of Roe versus Wade, the Center for Medicaid Services, a federal agency, issued a memo reinforcing the EMTALA laws that hospital emergency departments are required to provide stabilizing care to pregnant parties experiencing an emergency situation. Following this memo, the Texas Attorney General filed a lawsuit asserting that abortive care is not part of emergency services. Federal law and state abortion bans in Texas are now in conflict, creating a political and ethical dilemma for healthcare providers. So how does one abide by the state law while treating and advocating for a patient who's experiencing a potentially life-threatening pregnancy complication? So there's things to consider as a nurse practitioner in the emergency department. Abortion rights are an important part of reproductive health care. As part of comprehensive, holistic, and culturally competent healthcare, advanced practice nurses should be able to provide access to safe abortions, especially in emergencies. The ability to provide care to safe abortions will protect maternal well-being. So what is the potential solution? The debate for abortion is far from over. APNs who feel that restrictive abortion laws conflict with the best interests of the patient and their oath must campaign for policy change by supporting legislators. From an emergency care perspective, a potential solution for restrictive abortion law would be to work with state officials to provide care based on EMTALA, the federal law, providing stabilizing treatment to pregnant parties experiencing emergency medical situations, thus reducing maternal mortality.